There we go. Let me know when we should start. Thanks for everyone for joining.
Let's get started.
1 second. All right, we have 8 attendees so far. All right, I'll kick it off. All right, thank you everyone for joining. I'm Jamie Fox. I'm an account technology strategist at Microsoft and aligned to Allscripts. I am the special guest host today in the absence of Mike Gennady, who could not be here. I'm honored to be your guest host for the Microsoft HLS Partner Plays webcast. This webinar series is designed to spotlight Microsoft's valued healthcare ISV partners. Some housekeeping notes are, this session is brought to you by the Microsoft Health and Life Sciences team that I'm part of, as well as several other people on this call. Please be advised that we are recording this session today. A recap of the event will be posted early next week on the HLS blog found at https://aka.ms/HLS Blog. We want this to be an interactive session. Please feel free to ask questions. And if you need to, there's a Q&A panel. You can see it in your upper right-hand part of your screen. I believe that there's a little box with a question mark in it. You just click it, type in a question, and we will handle it for you. Today, we have a very interesting session spotlighting a recent nursing hackathon event called the Developer Challenge. It was put on by Allscripts, Matter, and the Sheba Medical Center. Today, I am joined by my esteemed panel, including Kathleen McGrow, the Chief Information Nursing Officer at Microsoft, who was a judge at the event, Paul Minton, who is the Chief Product Officer and a registered nurse at Allscripts, and he was also a judge at the event, and Matthew Coe, who's our Chief Operations Officer at DeepScribe, and which was the winning solution of this hackathon. For now, I'm going to hand it over to Kathleen McGrow, who will be your moderator from this point forward.
Thanks, Jamie. I really appreciate it. I'm very happy to be here. I am the Chief Nursing Information Officer. I want to make everybody clear, nursing comes before information in my title because I'm actually a clinical person. I'm a nurse, but I'm pleased to be here and facilitate today's discussion. Hi, Paul. It's great to see you again.
Yep, it's great to be here. I'm excited to talk to the folks about what just took place not long ago and talk about the value of it. So happy to be here with Microsoft and everybody else.
Awesome. Thanks, Paul. Really appreciate that. Hi, Matt. First, congratulations on winning the Developer Challenge. That is so awesome. And thanks for taking the time today to talk about DeepScribe to our listeners.
Yes, of course. I'm super excited.
Awesome. Thank you. So, Paul, I think we'll start with just describing the Developer Challenge event and its purpose for our listeners.
Perfect. So, it was this is something that we do on a somewhat regular basis. But what was amazing about this event, first of all, it was in honor of the 2020 Year of the Nurse. And I know Microsoft has been very supportive of this all year long in 2020 and Allscripts as well, and Matter and the ARC with Sheba Medical Center. So it was a great opportunity, especially as us being nurses, to be able to come together for this this innovative look at how we can solve some of the big problems in healthcare today, and mainly focused on our clinicians, right? Nursing and clinicians in general. So it was an honor to be able to, to do this and to be a judge on it. But it really is designed to bring these innovative technologies that a lot of these young companies and startup companies that are out there today working on for healthcare, to bring it to be able to highlight it and eventually bring it to market, right? And some of our products that we that we use today at Allscripts, and get some good feedback to these contestants, and really goal is to make a difference for our patients and our nurses and clinicians. So excited to have been part of this opportunity.
Kathleen? I agree, Paul. Thanks for bringing up the 2020 Year of the Nurse. I think we worked collaboratively on a couple of things, And we really did, Microsoft, we wanted to highlight that. It was because of Florence Nightingale's 200th birthday, and it was actually announced by the World Health Organization, I believe, in 2019. And of course, we did not realize how important nurses were going to be in this year with everything that's going on with the pandemic. So definitely, it's a great shout out to our nurses out there. I think in addition, I would add, Paul, that, as Allscripts is a strategic partner with Microsoft, this was a great opportunity for you and I and for Allscripts and Microsoft to work together and learn about the potential solutions and just the talent that we would want to collaborate with out there.
Yeah, look, couldn't agree more. And what we found out, through this whole process was, number one, this is an awesome process. We want to continue this together going forward. And number two, we're looking at healthcare the same, I think, in a lot of ways, both of our companies, right? And the need for innovation and the need to foster that creativity out in the marketplace. And I think the partners that joined us with Matter, Matter has been, is an incubator company that, is headquartered in Chicago, that's been doing this for quite some time, that we're supportive of. And then ARC with Sheba Medical Center. I think bringing all these groups together, has been something, it's just been an amazing opportunity, and so much excitement has been generated around this, that exactly why we want to continue this going forward.
For sure. Absolutely. So we saw some really innovative themes during the Developer Challenge. Paul, can you kind of talk a little bit about a few of these? Because we saw as judges, we saw all of the solutions that were in the challenge.
Well, yeah, absolutely. You know why? In some aspects, choosing a winner was hard. In other aspects, it was somewhat. There was a lot of good competition, right? And all that to say is that these the contestants had some amazing capabilities that they brought to us that we were able to look at. I mean, a couple of them that really stuck out, was one called WellSheet. WellSheet was one that really looked at predictive clinical workflow. It was a platform for that, and it was a good. It was a good, compilation of information that was absolutely needed for our clinicians in their workflow. So if you think about the EHR today, in some aspects, you have to go and search for information that's really needed and important to you. And this, what WellSheet did was to really be able to bring that into the clinician's workflow in a very easy way to be able to make some decisions based on that. So that they were a very good competitor, very good offering there. And then we also had, Avia. Avia was kind of interesting to me because, it spoke directly to nursing. It did two things for nursing, I think. And one aspect, it was, as we know in nursing, we have, we pick up extra time and extra shifts. And now with the world of telehealth and what we've done through COVID, there's a lot of opportunity for nursing through, through telemedicine to connect with patients and behavior health and be life coaches and things like that. And so they brought that platform together to be able to, have nurses easily find shifts that were available, that they could then connect via the mobile platform. Access is key, right, to patients to be able to practice what they've done every day in their lives as nurses. So that was exciting for us to see that as well. And then I think MedAware is another one that stuck out for me. MedAware was really, today when we order medication, we get a lot of alerts, important alerts, let's just say that, but sometimes the white noise is a little bit too much, right, for our clinicians, because of course I don't need to be alerted every time an antibiotic I prescribe grapefruit juice can interfere with the absorption of that. I think I know that by now. So what they have done is they've created an AI around really looking at the alerts that matter, right? That could change, patient's condition or not be effective at all, and deliver those alerts in a way that really let our clinicians, practice safely without being interrupted with too much of that white noise with alerts concerned. So those were a few that stuck out to me. What about you?
Yeah, so I was really impressed with all of the startups that pitched, and I did think it was a really tough decision. I thought that the variety was amazing, and the fact that we had so many, we had a variety. Not only was the solution variety amazing, the actual persons who did the pitch, right? We had some clinicians and we had some financial folks, and so it's kind of across the board for healthcare. I love that we saw pitches for artificial intelligence and imaging to help providers read radiographs. Using artificial intelligence to help with financial management and patient navigation through facilities, using the voice assistants for nurses, which I think you mentioned as well, really so that they could work at their top of license and actually, at the bedside, which I thought was great. It was a fabulous variety, very competitive. And it was fantastic seeing all of these innovations and knowing that we have a lot going on in the healthcare startup world. The competition was tough, so I'm really excited that Matt's here to talk about his experience and his winning solution. So I think that's awesome. But before we get to Matt, we're going to deep dive into that a little bit. I think, Paul, maybe just talk, if you could make a couple of speaking points just around what was the value for those that participated. We saw some great solutions. We had quite a few. So I'm just wondering, what was their motivation to be there, do you think? And from your perspective, maybe, just a few, brief speaking points on what was in it for them, right, to be there.
Yeah. Well, look, I think ultimately it's exposure, right? It's exposure. They've created this this product. Some of these companies had stuff already in the marketplace, and they were working on these new problems, and it was really exposure and an opportunity for them. And besides the great prizes that Microsoft sponsored, but there was really exposure for them and feedback, right? And I know Matt in a few minutes will talk about how important feedback is, but to be able to get feedback during different stages of the life cycle development of what you're trying to innovate on is so crucial, right, to continue that process. And so I think it was feedback, it was the exposure, and I think that ultimately what we'll talk about here in a minute with Matt is, there are some, next steps as an EHR vendor that we are looking forward to take with these innovative solutions, right? Especially with DeepScribe when we get to that point to talk about it. But that's what I think they look for as well, right? Is there an opportunity to move this further into the marketplace and maybe partner with a healthcare provider, a healthcare IT provider in the industry to really get their product out in the marketplace? And I think those were some of the key, things that I looked at or that I felt was an advantage. And so, Kathleen, what are your thoughts on that?
Yeah, I agree 100%. I think for some of the folks that are out in the innovation community, if, maybe they don't have access to clinical folks like you and I both had not only clinical background, product development background. So we have a good understanding of that. I think actually that's probably a skill set we mutually have, that bridge from clinical to developer, right? And we can bring that to these types of sessions. I think the ability, to mentor these organizations early on so that we can help them with that. One of the big reasons I went into health information technology is that I was told when I had a question about a system that I was working back in the trauma world, I'm not going to say when, it was so long ago, when I asked, why doesn't it do this, or why does it do it this way, or why doesn't, well, the engineers are in the basement, and you're going to have to ask them, because no one ever had talked to the engineers from a clinical perspective at what they really wanted. So I think that, yeah, I totally agree. I think feedback, mentoring, and then one thing, I don't know if you mentioned it, but I think networking, right? I think this is really an opportunity for each of these organizations to network even amongst themselves and maybe learn from themselves. I think you and I even mentioned two of the startups, we actually were kind of like, if they were together, it would have been like a synergistic approach that they would have had.
Absolutely.
So,
right. Absolutely right.
Yeah.
And what I would add is, the other advantage I think that the contestants had, or the entrants had, was, look, the team that we assembled to kind of provide feedback, ask questions, and judge the competition. Besides you and I, we also had, from We also had from Allscripts, you know, a lead designer, right? Somebody that's been in the industry in a while. So design was important, the human-centered design. It was talked about in some, you know, detail and how important that was. And so hopefully that message got across to some of the challenge, the people that participated. Then also with from ARC, we had you know, a judge that was really on the business side of that, right? For Sheba Medical Center, that is, you know, that they spend, you know, their whole, what they do is work on innovation and things like that from a business perspective. So I think they had a lot of good people on the panel that could ask questions and kind of discuss some of the things they were thinking about. And of course, we had, you know, we had a guest speaker, right, during our presentation, really provided a lot of value to these, you know, to the entrance, right, from Northwell. We had Dr. Oppenheimer, Michael Oppenheimer, and he is, of course, has been in the news, you know, with the COVID and everything that's going on at Northwell Health. So it was good, timely information that our, you know, that the developer had access to. So that was really well attended, a lot of questions, a lot of good answers. And so it was a really well-rounded event, and I think that they got a lot out of it. You know, that's what my hope was, and that's what we've heard feedback on.
Awesome. Thanks, Paul, for that. And thanks for that shout out for Dr. Oppenheimer. You're right. That was an excellent session. So Matt, we've kind of been talking overall about just, you know, the event itself and the purpose and how synergistically we're all working together. I am really excited to hear you talk about your actual solution, DeepScribe. So I guess the first question I have is, you know, just how did you maybe find out about the event, thinking of our listeners as they're kind of like, if they were thinking, wow, I didn't know about this, I might have had an opportunity here that I didn't know about. Can you talk a little bit about that? And then we'll get a little bit more into the actual solution that you have.
Yeah, of course. So we were actually contacted about the pitch from our good friends at Matter that Paul mentioned earlier. You know, they were a startup community, a startup accelerator out in Chicago. And when we learned about the pitch topic, which was to reimagine and create the electronic health record of the future, we instantly jumped at the opportunity. So, you know, we're always looking for ways for us to get our word out and share our innovation with the world. And, you know, it is at those times where it's a culmination of all the relationships that you've built, just being a part of the startup community, being part of, you know, what's in the know, and where innovation rests at the intersection of technology and healthcare, that you get provided these opportunities. And it just so happens that we were provided this one. So, you know, as our job as innovators, we do our best to let people know what we're working on, because, you know, a lot of times when you're kind of sitting inside just the startup community, innovation seems so common. Innovation seems here and now, but when you go out into the real world, that may not be the case. And, you know, opportunities like this really allows us to not only share our innovation with people and let people know that the future is now, but also, you know, get feedback on our product from the amazing panel of judges that we've had, in order to improve our product and make sure that what we're developing is something that's important and something that's going to accomplish our mission at DeepScribe.
Awesome. Awesome. Thanks for that, Matt. So for maybe our listeners who have an idea, innovative idea, and they're thinking, or they're a startup, right? They're, maybe small group or whatnot. It sounded to me like if there's an opportunity, they should just go for it. Just take it. If there's an opportunity to get the feedback or to get the connections, the networking, those types of things, even if they may not feel the confidence, because I think over time you get more confident, right? The more and more you pitch your solution, and the more you have interaction with the different folks in the community. Is that correct?
That's absolutely right. I think a lot of people, when they have a great idea, it sounds so good in their mind, but the moment they share it with people, that's when they start, poking holes at it, kicking the tires, and really through that iterative process is where your idea becomes a reality, and only through that process will you be able to start changing lives. And if you're not involved in the community, if you're not surrounded by people that are constantly going to challenge you and constantly try to make you improve and push you forward, it's very difficult to bring a product to market without that.
Awesome. It kind of sounds like life, right? You got to have people to challenge you, to make you better, to be in the growth mindset, to be the learn it all that we all want to be. Can you talk a little bit? Let's kind of switch a little bit to the solution that you have, DeepScribe. How did you come up with that? Can you give, like, what was the little seed that brought this innovation? Was it like an idea that you had and you just thought about it, or did somebody come to you and start talking to you about something? I mean, I guess I'm really curious about this, and I think our listeners probably would be too.
Yeah, of course. So the idea of DeepScribe really came about while our team was working at the Berkeley AI Research Lab. And at the time, I was also serving as the care coordinator for my mom while she had breast cancer. So I was flying between Berkeley and LA, just to be with her during these appointments. And obviously, it was a very difficult time for me and my family. And one of the things that I learned through that experience was that the care that was perceived is the care that is received. So, to me and my mom, in her experience, I hate to say it, but the perception of care was not there. Her oncologist was constantly running late, talking, over her shoulder to us, not really giving us the attention and the empathetic care that I really thought that my mom deserved. So coincidentally, during that time, I was actually sharing what was going on with my friend, who is now my co-founder, Akhilesh, and he suggested that I speak to his father, who is an oncologist. And it was through that conversation where we really learned about the problem of physician burnout, the problem of clinical documentation, and how it really was not right for me to blame my mom's oncologist for not providing that care. It's not that my mom's oncologist did not care about my mom. It's that she was just drowning under the sea of administrative burden that is required of her. And when we really looked at that, and I really looked at my experience, we really felt that clinical documentation was kind of the root of this. And while we were working in the lab, we were seeing just amazing breakthroughs in technology, really impacting every single industry but healthcare. And when we learned that clinicians were using, very, very outdated technology to solve such a burning issue, we really thought we could build something better. And that's really where, me and my co-founders just started geeking away and trying to create something. And really it was this, and this is a reason why feedback is so important. As technologists, I personally believe that, sometimes we have a wider vision sometimes than people that are actually trying to, that are actually living the problems that we're trying to solve. But without the feedback from the people that are living those problems, you can't really develop something amazing. And it was through this experience where, I'm not a doctor, I'm not a clinician, my co-founders aren't clinicians. And without the feedback and the iterative process that we've had in the very, very early days with some of our early pilot users, and just our aunties and uncles that were willing to let us kind of test in their workflow, we wouldn't have been able to develop the solution that we do today.
Well, thank you for sharing that really personal story. I think that a lot of innovation comes when, we have these connections because you have a passion for it, right? You really want to make it better. You're looking at it in the context of taking care of your mom. So I really appreciate that. That was very thoughtful that you shared that story. Can you talk just a little bit more about the problem that you're trying to solve with the solution? I kind of have an idea, but maybe a little bit more targeted. Maybe a specific use case might actually help our attendees and our listeners understand a little better.
Yeah, of course. So the problem that we're trying to solve today is the epidemic that we're seeing of our physicians and clinicians becoming clerks. So studies have shown that physicians are spending nearly 40% of their day on documentation. And as a result of this, everybody loses, right? You have the joy of care that's being, ripped from our physicians, leading to dangerous levels of physician burnout. You have hundreds of billions of dollars in costs and lost revenues inside our health systems because you see highly skilled workers spending nearly half their day not practicing at the top of their license. And finally, something that everyone can relate to as patients is we're unsatisfied. You know, you go and see your clinician, and on average, patients get about 1.5 minutes of direct face time with their physician in the average encounter. And you would think that that is a little backwards, right? When you go take out your time out of the day to go talk to your physician, you want them to look at you. You want them to hold your hand and tell you everything's going to be okay. So what DeepScribe really does is we use technology to turn the physician's chair back towards the patient. And the reason why the physician is, you know, glued to the computer is because for every hour that a physician spends with the patient, they need to spend up to 2 hours documenting those encounters. So the reason why they're staring at the computer is because they're always trying to finish their documentation as soon as they can, just so they don't have to go home and spend 3 hours in their pajama time writing these notes. So at DeepScribe, we've created a solution that records the natural conversation between the patient and the physician. And through artificial intelligence and natural language processing, we're able to generate the comprehensive clinical chart that the physician would have otherwise written for them. And in doing so, you know, we've been able to demonstrate a profound impact on the clinical workflow. Today, we have the product live to hundreds of physicians all over the United States. We're saving doctors on average 2 hours, 2.7 hours every single day on their documentation. So that's just a little bit about you know, what problem we're trying to solve and what our company actually does.
That's awesome. Thanks for that, Matt. You know, I really appreciate that you quantified that burden, because I think we do hear, incidentally, we hear physician burden or provider burden, right? Because, you know, I like to key in on nurses too and think about they are also, you know, have a significant amount of documentation that they need to do. And of course, over time, it's just kind of snowballed, right? It's, you know, the more regulatory, I think during COVID, now you've got, on top of all of it, your patients, you know, are in isolation and you can't necessarily document at the bedside, so you need to move it out, so then you have to delay and things like that. So I really appreciate that you kind of quantified that, so that we all have a better understanding. Can you tell us what's unique about DeepScribe versus some of the other documentation products on the market? I know there are other vendors that may do similar. I'm curious to know if there's a differentiator here.
Yeah, of course. You know, I think ever since the beginning of time, documentation has always been an issue. And today there are a wide suite of tools that physicians actually use. So most physicians today use a dictation tool. So these tools are, you know, speech-to-text technologies where you speak into a microphone and it transcribes verbatim what you say. And a lot of doctors use these solutions because they're extremely accessible and they're extremely scalable. But the issue is these solutions really just lift the burden of typing and not the burden of the documentation itself. So you're trading in a keyboard for a microphone. While other physicians, they use actual human scribes. So these are physicians that have medical students follow them around to write their notes for them. And you see in the studies, you see the most impact from these human scribes. And the reason being is because these human scribes are actually lifting the burden of documentation, in that they're intelligently listening to a conversation, they're understanding what is medically relevant in that conversation, and they're, you know, categorizing and summarizing those concepts into a language appropriate for a medical record. So we at DeepScribe, we aim to join those two. You know, DeepScribe is unique in the sense that we are an ambient solution. So we provide the quality and the experience of having a human medical scribe that is listening to a conversation intelligently, you know, classifying all the medically relevant concepts and summarizing those concepts into sentences that the physician would have otherwise written. But we're doing that through technology, which provides the same accessibility and the same scalability as you see with some of the speech-to-text technologies out there today.
You know,
That's awesome.
Kathleen, what I'd add, or, you know, add to that is when you take and I think that's what's unique and that's what the differentiator is, because I think Matt kind of positioned it well. It's the technology being used in a way that's really going to decrease that burden, and ultimately, the vision for that I see with this type of technology is that as the models get better, stronger, that it is completely it becomes completely a technology solution that really just changes the game. And when I say by that is, we want to reduce the noise, right? And the noise being the regulatory burden, the financial burdens that, our clinicians or physicians have to look at every day as part of charting. And so being able to use technology to put that in the background and just practice at the top of the license is amazing. And so, the vision is taking that and making things actionable, right? So we have all this technology, let's make things actionable, like, for example, orders, follow up, discharge, automate the entire process using this technology, because the technology, it exists, it's there. It's late adoption in healthcare, which is, I think Matt spoke to eloquently earlier. But I think this is, when we think about, everybody's heard about EHR 2.0. This is EHR 3.0, and something that we can have today and create that nice, transition to what we call, not just an EHR, but a platform of health. And so I think that's what's amazing about this capability.
I love that, Paul. A platform of health. That's a concept, right? That's awesome. And we could probably have a whole conversation around that. I would hazard a guess that any clinician, physician, or nurse would tell you that when they went to medical or nursing school, they wanted to do patient care, right? It's all about, for us, it's all about the care and the cure of taking care of patients when they're sick. And they really, they understand that there's communication and there's documentation that does need to occur. But I think, as I said before, just kind of the snowball of how large it's gotten, how much that burden has gotten, is just absolutely tremendous. I'm really glad, Matt, that your mom had you to help her with this and that you actually saw this opportunity, because I do think that there's so many of our patients that cannot advocate for themselves and maybe wouldn't say, doctor, you're always looking at your keyboard, I'm over here. Because we really don't want that to happen right in care, right? We want to be empathetic and compassionate to our patients. So thanks for that. I really appreciate that you explained that. I guess I did have a question just around, when you're talking about, as far as being accessible and scalable and using the ambient tools. I'm assuming, Matt, but I don't want to make an assumption here. You're using things like artificial intelligence and machine learning, and you're using all those capabilities of the technology that we have today, correct?
Yeah, absolutely. So, the only way today that we're able to provide that technology is through some of the research that we were doing in the lab. So all the technology that we developed at our company is completely done from the ground up, completely proprietary, and without really rethinking the problem and being there in that seat, staring at a provider's back. It's I would say it takes a lot to be able to kind of rethink the way people do things, because I will say that when we started DeepScribe, our product was nothing like it is today. We actually started with a more wake word based solution that really required physicians to interact with our product, for it to key in on things and for it to document. And from a technology perspective, that is a fundamentally different problem than what we're trying to solve today, which is trying to understand and structure an unstructured, free-flowing conversation. So. Understood.
Thanks for that. Thanks for expanding upon that. I appreciate that. Paul, let's talk a little bit about, we really, we saw these great startups during the developer challenge. We had the four of us judges, we walked through each one of them and we talked about the pros and cons for each one of them. What was it that you were really like immediately hep on DeepScribe? What was it that really intrigued you about them that ultimately led them to the victory?
Yeah, no, look, it would, to me, again, we said a lot of good products that were showed or solutions that were shown, but I was immediately, as you saw, attracted to DeepScribe. I guess it started for me right away with, what DeepScribe is trying to do and what their mission was. I mean, the fact that they led with joy of care, bringing back the joy of care into medicine, that had me pay attention, right? Because that's a huge, bold statement. And I think we mentioned it. I mean, the burnout rate for our clinicians is incredible in this country, and we're not, we're putting out, scary thing is, in some areas, we're putting out more people are leaving the industry because of burnout than we're bringing in. And that is not a situation we need to be in this nation, right? And, just another fact, the suicide, and I hate to bring up a grim statistic, but the suicide rate for physicians from burnout, due to burnout, are twice that of the population, right? The general population. So this is a serious problem that has to be solved. And when I saw the presentation, I knew immediately that this could be that solution that really goes a long way to solving that. And Matt's right. I mean, people, let's not necessarily blame the oncologists. We've created, and I say we, all the regulatory requirements and the financial checking and check boxes, and so we've created a perfect storm, right? And I agree, some of those regulatory requirements, they're needed. So I'm not bashing them at all. I
Sure.
think meaningful use was a good vision, a good thought. Sometimes how we implement it hasn't been so good, and it's caused some of this stress, right? So when I saw that, the product that they have brought to the market in this way, I knew instantly that this could be that, the solution to the problem that we're facing. And I think it, again, over time, it's not, in my mind, this was also, to me, why is not, nursing is going to be using this as well. And not just physician, because it's applicable in everything, and everything that we do on a daily basis as clinicians. So that's what really got me excited about DeepScribe.
Awesome. Thanks, Paul. And I love, you're talking about nursing using this too, because I totally agree. Like this is absolutely something that could help nurses. So how about, Paul, just give us some ideas on what the next steps are, and how you and DeepScribe, how Allscripts and DeepScribe will be working together.
Well, so we've already started some conversation, of course, with Matt, because this is something that we're very interested in partnering with on Matt and bringing it to our clinicians within Allscripts and our Sunrise application specifically. And so we're in, I would say that we've got some preliminary things out of the way, and now it's a matter of how can we integrate that into the, into the our EHR. I know there's integration that's available, but we're in the middle of, when we announced our partnership with Microsoft, our extended strategic partnership with Microsoft, we're in the middle of switching, of course, to Azure, and moving Sunrise to the cloud and the Azure cloud. And so it is a great opportunity first to create a new paradigm for clinicians that was really, human-centered and focused on what they do. And so this is an opportunity that we saw to really take what Matt has done is integrate that into the process. So, we're in the middle of discussing those things and how it would look and timing around that. So it's very exciting. And the other thing to say is that, even with some of these other competitors that we saw compete that had really great ideas, I think it's important in the industry, and especially in the EHRs, that they have a means by easily integrating those capabilities into the EHRs, right? So our clinicians and patients can benefit from it. And for example, at Allscripts, we have what we call our ADP, which is our Allscripts Development Partnership, where we measure things in the amount of transactions that we've done with third-party vendors such as DeepScribe to be able to integrate and have an app store, right? It's the app economy. And I can't remember, but I think it's somewhere over 6 billion transactions. The number keeps growing that we've done with companies like DeepScribe. So very important thing for EHRs to kind of really embrace this innovation process and create a method by which they can integrate easily and and have all that taken care of through through those types of app stores. But I'm excited about what the near future holds for us in DeepScribe, and Matt's been really awesome and with working with us. So we do see some really good value coming out of this, and more importantly, it I think will be a game changer for the clinicians as we go forward.
That's fantastic. That's great. I really appreciate your time, both of you, and going through and describing the solution and how you'll be working together moving forward. I'd also like to just mention that there's quite a few resources that are available for startups who may be interested in participating in these types of events. First, I'll suggest that our attendees may be interested in joining the many hackathons that are held. Hackathons offer great opportunities for innovators to get mentorship and feedback on their solutions. In addition, Microsoft has a specific program called Microsoft for Startups, which has many benefits and that startups can apply at startups.microsoft.com. So thank you, Paul. Thank you, Matt, so much for taking the time today to talk about the developer challenge. And I am really looking forward to the next challenge.
So Kathleen, this is Jamie. We have a question in our Q&A. I'll read out loud.
Okay, sure.
Sure. The question is, for customers with large speech technology infrastructure in place, Dragon or M-Modal, are you leveraging these platforms or replacing?
So I think, Matt, yeah, if you want to take the first stab at that, and then I can add some color.
Yeah, of course. The way that I view the landscape is there is not going to be a one winner take all, right? I believe that the providers should be given the freedom to choose what tools work for them. I think a lot of cases, there are issues with different types of products with speech to text technology. Sometimes it's not as accurate, but with scribe technology, you deal with training and attrition and all of these things. And I think by providing the option to providers to select which one works best for them is really where we're going to see the market go. In terms of us leveraging these platforms, we are not using their speech to text technology. We've actually developed our own. And in a lot of cases, we have seen our technology replace these solutions, whether it be speech to text or whether it be human scribes. But there are certain cases where some providers have been using these technologies for 20 years, 30 years, that at this point they've already designed their workflow around it, and they're not really looking for anything new. Yeah. But Paul, I'll let you add.
I think interoperability with different choices is extremely important in the marketplace. I'll say that for Allscripts, we've supported some of the biggest voice vendors in this space, because again, we ultimately want our clients to decide. But I do think we owe as a service, when we see technology that can really make a difference, and obviously pricing and all those things have to be competitive, because we know healthcare is commoditized, and we also need to provide solutions that fit within a budget, right? And so there's where I look at it, when I see with Matt, is there's an opportunity to bring all the goodness that he is doing, because there's a lot more I think that we can do together with Matt, and provide some of that innovation with Matt along with what we're doing. But ultimately, we try to create what we'd call a black box approach, right? You can plug in a vendor that you want to a certain degree, right? But there's always going to be that question, what's the differentiators, and that will really set the market stage for us. And so, just to agree with what Matt was saying, but we also look to see what those differentiators, because I'll be honest, I'm kind of selfish, and I look around to see what can position me better in the marketplace than my competition. And so that's just the nature of the business, especially being a chief product officer. We look at those things all day long, every day.
Thanks. Any other questions, Jamie?
That is the only one we got.
Okay, Awesome. So I'll say thank you again, Paul. Thank you again, Matt. We really appreciate your time for talking about the Developer Challenge. And again, I do look forward to the next challenge because I'm sure there's going to be another one coming up in the near future.
Absolutely. Thanks a lot, everybody.
Thank you.
Thank you, guys.
I'll turn it back to you, Jamie.
All right. Thank you to our panelists today, and thank you for joining us. We'll have the recording of the webcast posted early next week on our HLS blog. Again, it's //aka.ms/HLS blog. Hope to see you there. Thanks for joining today.